Hello and welcome to Medical Dialogues. I am Dr. Bhumika. Let's look at today's top medical news. Addressing lymphatic pain in breast cancer survivors. Among the 7.8 million women with breast cancer worldwide, at least 33% to 44% are affected by lymphatic pain. Breast cancer survivors usually suffer lymphatic pain in the ipsilateral body or upper limb, and pharmacological approaches are not effective for lymphatic pain. In a recent publication in Women and Children Nursing, a group of researchers from the United States and Spain further deepened our understanding of this particular type of pain through evidence-based knowledge and insights into precision assessment and therapeutic behavioral intervention. Historically, the concept of cancer-related pain has been used to study chronic pain associated with cancer or cancer treatment. Cancer-related pain refers to persistent pain that continues more than 3 months after active cancer treatment, says lead author GNQ, a MD PhD student at Harvard Medical School. Conventional research on chronic cancer pain focuses on occurrence and severity of general bodily pain in any body location. This approach has not been able to distinguish different types of pain after cancer treatment, such as lymphatic pain due to fluid accumulation and inflammation, general bodily pain, post-mastectomy pain, chemotherapy-induced peripheral neuropathy, or arthralgias related to hormonal treatments. Can decisions like what to have for breakfast impact your health and energy levels? The current study employed a mathematical model for men's and women's metabolism showed that men's metabolisms respond better on average to a meal laden with high carbohydrates like oats and grains after fasting for several hours, while women are better served by a meal with a higher percentage of fat such as omelets and avocados. Lifestyle is a big factor in our overall health, says Stephanie Abo, an applied mathematics PhD candidate and the lead author of the study. We live in busy lives, so it's important to understand how seemingly inconsequential decisions such as what to have for breakfast can affect our health and energy levels. Whether attempting to lose weight, maintain weight, or just keep up your energy, understanding your diet's impact on your metabolism is important. Can the position of arm during blood pressure screening overestimate test result? A study led by Johns Hopkins medicine researchers concludes that commonly used ways of positioning the patient's arm during blood pressure screening can substantially overestimate test results and may lead to a misdiagnosis of hypertension. In a report on the study published in JAMA Internal Medicine, investigators examined the effects of 3 different arm positions: an arm supported on a desk, arm supported on a lap, and an unsupported arm hanging at the patient's side. Researchers found that lap support overestimated systolic blood pressure by nearly 4 mm per Hg, and an unsupported arm hanging at the side overestimated systolic blood pressure by nearly 7 mm per Hg. The findings confirm that arm position makes a huge difference when it comes to an accurate blood pressure measurement, says Tammy Brady, MD, PhD, Vice Chair for Clinical Research in the Department of Pediatrics at the Johns Hopkins University School of Medicine, Medical Director of the Pediatric Hypertension Program at Johns Hopkins Children's Center, Deputy Director of the Welch Center for Prevention, Epidemiology and Clinical Research, and senior author of the study. And they underscore the importance of adhering to clinical guidelines calling for firm support on a desk or other surface when measuring blood pressure, the investigators added. The latest clinical practice guidelines from the American Heart Association emphasize several key steps for an accurate measurement, including appropriate cuff size, back support, feet flat on the floor with legs uncrossed, and an appropriate arm position in which the middle of an adjustable BP cuff is positioned at the mid-heart level on an arm supported on a desk or table. Systematic review shows FDA antidepressants warning linked to mental health care decline and rising suicide rates in youth. The long-standing epidemic of severe pediatric depression is a significant public health concern, with only 1/3 of the affected population receiving any mental health care. A new systematic review suggests that FDA-issued warnings about antidepressant use intended to increase monitoring of suicidal thoughts among youth have led instead to unintentional harm. The study was led by the Harvard Pilgrim Healthcare Institute with the collaborators from the University of Pennsylvania, London School of Economics and Political Science, Northeastern University, Drexel University, and the University of Sydney. The findings were published in the October issue of Health Affairs. Since 2003, the FDA has advised that antidepressants might be linked to suicidal thoughts and behaviors in young people. These warnings upgraded to a black box warning in 2005 for those under 18 and an expansion in 2007 to include young adults up to the age of 24. were intended to encourage physician vigilance in monitoring patients for suicidal thoughts and behaviors. However, experts say evidence showed they resulted in a decline in pediatric mental health. The study team screened a total of 1841 research reports published about the warnings spanning the period between January 1, 2003 and October 31, 2022. Of these, 34 measured the outcomes of the warning, 11 of which met well-recognized research design criteria. These 11 reports included studies measuring abrupt changes in outcomes, trends following the October 2003 FDA advisory and or January 2005 black box warnings. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.